Welcome to this virtual special meeting of the Washington Medical Commission. My name is John Malden. I'm a public member and the current chair of the Washington Medical Commission. As this is an unusual occurrence for us, I will take this opportunity to remind attendees and commissioners how these meetings operate. This is considered a special meeting called by the chair in accordance with Article 4(2)(a) of the Washington Medical Commission bylaws. This meeting is an open public meeting and complies with the requirements of the Open Public Meetings Act. While this meeting is open to the public, we will not be taking public comment or responding to questions during this meeting. For those wishing to address the Medical Commission through comment or questions, we encourage you to attend our regular policy and business meetings or any of our rules workshops. As of the dates and all of the dates and attendance details for those meetings can be found in our event calendar and our website at wmc.wa.gov. We are only discussing the single item on today's agenda. As this is an open public meeting, I am reminding commissioners to refrain from discussing any information related to ongoing investigations or cases. Understandably, there is a high level of interest in COVID-related complaints and associated cases. This leads me to the reason for this special meeting. So let's move into discussion of the items on our agenda for consideration and potential adoption. Micah, would you like to introduce the proposed COVID-19 misinformation statement?
Sure. I just would like to touch on a little bit of housekeeping as we go forward. So number one, there is significant interest in this event and the material under consideration. As commissioners, you are in the public eye, and as such, you may be contacted by media or other interested parties. I want to remind you that all media inquiries should be directed to our very own Public Information Officer, Stephanie Mason. She will provide the contact email in the chat for all to use if needed. If any members of the public contact you directly regarding this meeting or its content, please refer them to our program manager, Amelia Boyd. She will work with leadership to appropriately address the question. And finally, we have active investigations in cases that touch on the subjects addressed in the proposed position statement. I want to take this opportunity to remind you all that this is a public and open forum. Please refrain from discussing any case-related details, even hypotheticals. With that, I'd like to turn to the statement. The statement was developed from a statement from the Federation of State Medical Boards, the California Medical Board, the FDA, and the CDC. The Executive Committee has previously reviewed it and made comments and edits, and we have had several lawyers take a look at it from the Medical Commission. So with that, I will leave it open to the commissioners for review and comment.
Hopefully, all of the attending commissioners have had an opportunity to read the statement. Are there comments? Don't be shy.
I have a comment. This is Jim Anderson, PA. Okay. Yeah, sure. May I proceed?
Yes, please.
Okay, great. Thank you. I think this is really well crafted, and I think it's based on the science. It's based on the scientific leaders who guide all of us, and we as medical providers, whether we're physicians or PAs, those of us who are clinicians, we are bound to follow the science. And to me, I mean, medicine by analogy often fails. And with that noted, I think if a medical provider were to tell a patient, yeah, forget about the recommendations about cancer treatment, let's try something that's not recommended, that would be something that if someone complained, we would look at very carefully. And that's just one of many analogies that I think are relevant. And I think this is a well-crafted and very timely, and I completely support it.
Thank you, Jim. I agree that I think there are a number of standard of care issues in your example of cancer care is a good one. And I think that this is an emerging, COVID care is an emerging science, but there are some very solid scientific issues that support the appropriate care, and the appropriate agencies of the government, as well as medical boards, have recognized what the appropriate standard of care has been, and it's the Commission's intent to follow those same scientific principles in adopting this statement. Do we have other comments, Dr. Curry?
I have a quick question. Micah, you might be able to answer this quickly. There's 2 different versions we received. I was wondering if you could just speak to the history of those changes.
The history is largely some commissioners being out of the office. So we had an initial review by the executive committee, and Dr. Roberts was not able to attend that particular meeting due to a personal issue. So he brought back and had some comments. He really wanted to try and take some of the political aspects of it out, or perceived political aspects of it out. He felt strongly, and I feel okay summarizing what he was saying there, in that it's about standard of care. Providing misinformation on a disease process is about standard of care, and those are the edits that he really was trying to bring in and make sure that was clear in the second version, I believe. And then the only other change that I'm aware of, it was one that was caught by the legal unit. I think actually one of our staff attorneys was the one that caught it, and adding physician assistants in there and making it explicit that it's both licenses that we regulate.
Dr. Yu, you have a comment?
Yeah, thank you. I think this is about time to the commission to stand up to really say misinformation harm patients, and I think we were doing the right thing, and so I fully support what have been written here and our position. I just have a question about the second paragraph. The beginning is said with vaccination mandate by the governor and others in Washington state. Is there any reason we did not include the federal mandate?
Aside from the fact that the governor's mandate seems to apply to Washington state, where our jurisdiction is, that's really where it came from. I think that's to some degree what the edits by Dr. Roberts was trying to get at, to not touch on what elected officials do, but touch on what the disease is and what the standard of care would be for the disease process.
So eventually that first phrase will be removed, like in that red line that crossed out. Is that right? I'm trying to understand the 2 versions side by side. In the version to the right, that phrase with vaccination mandate, that phrase got crossed out. Is that what we're proposing, that this will be removed? Is that right? Or what are you saying?
Yes, my understanding is the red line version is the one that Dr. Roberts submitted for your consideration.
Okay. Another thing, just minor, maybe I'm not right. It's the second paragraph at the end. It says that are not based in established science. I would say that's not established on established science. That's minor. That's just my choice of words. So yeah, I think it's a good documentation. Thank you.
Thank you, Dr. Yu. Additional comments by members of the commission? Dr. Chung?
Yeah, I just want to support the version on the right, I think it further clarifies Mr. Anderson's previous point about how our position on the management and prevention of COVID-19 is really processed just like any other disease process. So I think it's important to maybe spell that out so that it does rise above any potential political opinions that people may have, as well as the elimination of that first half of the sentence in the second paragraph, because regardless of whether or not there's a vaccination mandate, we would still scrutinize any complaint that about the practitioners practicing in any way that is not based on an established science. So I think those are good edits, and I would support that.
Thank you, Dr. Chung. Anyone else have a comment to make, observation? Can't, Dr. Trescott?
Yes, John, I think I like the document, and I think we need to go here with it. I think what keeps me up at night is the idea of we may have disciplinary action and what that actually means with this group of problems for us, how we are going to do discipline. You know, I had one ivermectin case early on before it had become a popular drug in social media.
I'm sorry, Dr. Trescott, I'm going to have to ask that you not discuss any cases related to this. Any sort of case discussion does not need to happen in this forum, please.
So nothing about cases, like
even in hypotheticals, we need to not be discussing cases or investigations under process or things that have not passed through the judicial review standpoint or the reconsideration process has not been completed. So we need to avoid making those conversations. Thank you.
Yeah, thanks for bringing that up, Micah. But I do worry about what it means when we say disciplinary action. Is that discussing a case? That's not about any case at all.
I think what you're doing here is you're considering the position of the commission with respect to these items. That means that if you so adopt this, then that means that this is how the commission is going to view these items, and that they will be subject explicitly to some form of discipline, whether that is, should you approve it at some point, the clinical support program, whether that is a STID, whether that's an agreed order or going to a hearing. What you're doing is you're putting the licensees and the public on notice that this is how you view these issues. And so for the purposes of this meeting, it's a very, I guess I would call it a fairly black and white decision of, do you view this as appropriate guidance for the staff as you move forward with respect to how you view complaints and potential practice violations or not?
And I do agree with overall.
Okay.
That's a broad statement. I guess what I worry about is how we're going to implement it, but that'll be left for the future, I guess.
That's the benefit of leadership, you being in leadership, is you can tell us what you want and we'll have to figure it out.
That'll be the day, Mike. No, just kidding. True, but thanks for reminding me not to get too into the weeds here.
Thank you, Dr. Trescott. Dr. Chung, you have additional comment?
I just had a procedural question. Seeing that this is a position statement for the medical commission, is there something built in that allows us to, or gives some kind of a schedule by which we would review position in case we have additional data or additional evidence that comes to us in the future, or is it as needed?
I would say that's an as-needed thing, but if you notice the statements with respect to, say, ivermectin and hydroxychloroquine, you know, if the FDA finds evidence for either of those to be used on COVID, we can simply update it and say that they have approved it. But it's really guided by what the FDA current guidance is, and it does not indicate at this point that that's going to change much, despite the studies that are ongoing.
Dr. Lewis?
Can you hear me?
Yes.
Yeah, okay. I just was going to speak to what Claire had said, and in very general terms, not about any specific cases. I do know that situations have come up in the past where medical practice that we have received complaints about has not been consistent with evidence or science or standard of care. And as with anything, we look really carefully at that and pay a lot of attention to those complaints, just as we pay attention to every complaint, and investigate it very, very carefully, and are very thoughtful about circumstances surrounding it and how we would proceed, you know, in our response, whether it's discipline or education or the various different modalities that we have available to us to respond to these kinds of complaints. So I appreciate what Dr. Roberts added, because I think in my mind it just reinforces that this is like much of what we do in the commission, and our role of protecting the public is that we want to make sure that the care that's being provided to residents in our state, it meets a standard and meets a safe standard and is high quality. And that's our job, and we'll do that in a variety of different settings and a variety of different problems. And this is just one of them, and we're just making that very explicit because it's an issue that one reads about and sees every day in clinical practice and in the newspaper and that.
Thank you, Dr. Lewis.
Mr. Malden?
Dr. Prescott, additional comment?
Go ahead.
I'm curious. The other thing that's keeps popping up in my brain is this mandate that we have to, for our alternative medicine, that we have to allow a certain amount of alternative medicine unless we prove that it's harmful to patients. And I don't know where that policy came from. I wasn't here for that history, but that feels like that's another policy like this that tells us how to categorize some disciplinary offense. And it might overlap with this, where this is an alternative care, and is it harming patients or not? Can you help me clear that up, Micah?
Yeah, I can speak to that. So first off, it's not a policy, it's actually statute. And the statute is alternative medicine shall not be the sole basis. The practice of alternative medicine shall not be the sole basis for discipline. And so that's really where that's been. It's been in statute for quite some time. And you're right, you do have to speak to the actual evidence of patient harm, just like you would in every scenario with an investigation and case. But again, that's not something that we're going to be able to address in a COVID-19 misinformation statement. And so I would encourage us to remain focused on that particular item so we can get to a vote of yes or no on the statement.
Mr. Rogers, you had a comment?
Yes, and my apologies to Dr. Trescott. I heard Scott, and so I thought you were calling on me. Yeah, for the reasons stated already, Dr. Chung and Dr. Lewis, I'm in support of Dr. Roberts' redlined version, specifically because I think it answers a lot of the questions raised by pointing out that this is not a new policy. This is not a new rule that we're making. We're following everything we have always followed in looking at evidence-based medicine as a public member commissioner, particularly over here on the east side of the state, I've actually been approached many times, and I always tell people that I can't speak for the commission and I can't discuss any of the anything that we're working on outside of the commission, but there is a lot of misinformation over here, particularly regarding ivermectin. And I just wanted to point out there are a lot of studies that are pseudoscience that are circulating on the internet. There are a lot of regular scientific journals where I think a lot of lay people are looking at the journal articles and seeing that they sound scientific. There are proposed mechanisms of action. I think the recent journal article I saw proposed up to 20 different mechanisms of action for COVID. That does not mean that those are in any way proved. In fact, I worked at Merck Research Labs. I know a little bit about ivermectin. It's one of the corporate legends, and I would just implore anyone who sees a proposed mechanism of action to ask pharmaceutical about the graveyard of new candidate compounds, where there are incredible papers proposing mechanisms of action. But until you do the research, until you measure, until it goes into clinical trials and you see the data, you don't know what is going to happen based on proposed mechanisms of action. The last statistic I was aware of is about 1 in 2,000 of those compounds, families of compounds that are selected for research. Only about 1 in 2,000 actually will prove anything of clinical relevance. So I'm glad that we have that statement in there. I also agree with Dr. Chung if we, there are ongoing clinical trials with ivermectin. But even the World Health Organization, even considering third world countries, is stating that ivermectin is only appropriate for use in clinical trials, and there are very few of those going on. So I support the redlined version, and I don't know if we're ready for a motion, but I would move that that we adopt the redlined version as our statement.
I
Dr.
would
Gallen has
second.
had his hand up for a while.
Okay, I can't see everybody, so
Right.
go ahead.
Thank you. I just wanted to express my support. You know, as a practicing emergency physician, we're at the front line, and we are continuing to get bombarded and overwhelmed by patients who are not vaccinated, and I think in large part because of misinformation. And I believe that we should be standing up on behalf of the practice of medicine. And so I like that this statement is beyond just a standard of care of what potential treatments are, but to really to express our expectation from a professionalism standpoint for what is misinformation, and even to the specific degree of like doing medical exemptions for vaccinations as saying that that is not something that we want nor will support without a legitimate medical reason. I think that these are all really important things for us doing our part, because our health system is at times, you know, feeling very much on the brink of being overwhelmed. And I think we need to do our part from a policy standpoint to really promote the safe practice of medicine, and then the reminder of what it means to be a professional and how that actually is in action. So I'm glad that we're taking this. I hope that this translates into more of our colleagues across the practice of specialties of delivering healthcare in Washington State will do their parts too, because we represent just one part of this.
Mr. Malden, I want to second Mr. Rogers' motion, and that doesn't mean we have to stop discussion, but I did want to get that in there.
Going to call for that, Jim, but not yet. Dr. Yu still has a comment.
Yeah, I just want to, you know, interesting comments about in comparison between alternative medicine and with this like ivermectin. I think there's a distinction between disinformation and alternative medicine. And, you know, the alternative medicine, sometimes you have the evidence sometimes support, but it's not fully support and may have applied to somebody. I'm not a medical doctor, but disinformation, it put out that this information, there is no valid science at all. Like ivermectin, the FDA say you are not horse. This is not about treating human. And there have been patients that have been harmed about it. So when present this, say this is a work for COVID, preventing COVID, that's called disinformation. It's not alternative medicine to me. So that is not scientific-based practice for medicine, and that needs to be stopped, especially during this COVID that have been harmed so many people.
Thank you, Dr. Yu. Last call for comments.
I would like to make a comment, Dr. Murphy.
Thank you, Terry.
I'm Dr. Terry Murphy. I'm an emergency physician on the front line in Central Eastern Washington. And so I would just like to give my support for the amended version of this document and say to the public, you know, we're trying to protect you. And whether you're vaccinated or not, if you have COVID and you're vaccinated, we will do everything in our power to save your life. If you are unvaccinated and have COVID, we will do everything in our power to save your life. But these are unprecedented times. I have never worked in a state, and I've been licensed in many states and even Canada, where I've been told after 30 phone calls, there is not a bed for your patient. And so we have to shift our focus from treatment, which, you know, we are working hard to treat every single patient, to prevention. And, you know, that's part of this document too, is, you know, to give people comfort. I've taken care of so many people that said, I was supposed to get my COVID shot tomorrow, but I'm sick now. So I hope this helps. Thank you.
Thank you for those comments, Dr. Murphy. We have a motion and a second to adopt the COVID-19 misinformation statement. All those in favor, raise your hand or signify by saying aye.
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 Opposed? Hearing none, the statement is adopted by the Washington Medical Commission. Thank you all very much. Please note on the screen that you can direct all questions to Stephanie Mason, Amelia, or anyone else, any of the remaining staff. So thank you very much for attending. And with that, we will close the special hearing. Thank you very much.